Hi, I'm Dr. Karen Osborne. I'm going to be talking about the levonorgestrel or hormonal IUD, more commonly known as the Mirena IUD. The hormonal IUD can be used in all sorts of women to help with their contraception and also for period control. We would recommend it in all age groups, from teenagers right up until women who are going through the perimenopause. The hormonal IUD is a soft and flexible plastic T-shape. It's not a scary piece of metal. And what we do is we insert it through the cervix into the uterus. It comes out of the box in a big long tube, and we insert it into the uterus where it will sit here and it does its work from the inside. What it does is it secretes a very small dose of a hormone called levonorgestrel, which is a derivative of progesterone, and it secretes that directly into the uterus lining. If you have that, then it has an effect where it reduces down the uterus lining significantly, thereby making less menstrual blood that needs to come out. So what we tend to find with women who have a hormonal IUD is that they will get around about a 95% reduction in menstrual blood flow, and half of women with a IUD in hormonal IUD will get no periods at all whatsoever. This can be highly desirable as a side effect. So one of the side effects that we like, this can be highly desirable for treating heavy menstrual bleeding, problematic bleeding, particularly in groups where women are getting flooding and clotting and it's interrupting their lives. Also around perimenopause time, this can be a very desirable side effect of the IUD. Now, women who are requesting a hormonal IUD to help with heavy menstrual bleeding, this can be a fabulous option for treating your heavy menstrual bleeding, but we do need to make sure your heavy menstrual bleeding is not caused by a sinister or pathological process. By that I mean that we need to make sure that your uterus is free from polyps or large fibroids that might make a hormonal IUD very difficult or almost impossible to insert. We also need to make sure that there's no sinister pathology such as, worst case scenario, endometrial cancer before we proceed to put a hormonal IUD inside. So what we would recommend is that a pelvic ultrasound be performed first, maybe some blood tests and a cervical screening test, just to check that there is no pathology that may be causing heavy menstrual bleeding. If we rule out pathology, then a hormonal IUD is usually a fabulous option for trying to treat heavy menstrual bleeding.